The aroma of freshly brewed coffee filled the air at a bustling Mumbai cafe. The aroma of freshly brewed coffee filled the air at a bustling Mumbai cafe. Samir, a seasoned medical representative with over 15 years under his belt, took a slow sip. He had seen the Indian pharmaceutical landscape change dramatically. Across the table sat Priya, a bright and energetic professional who had recently been promoted to a key account manager role at her company. They were old colleagues, and their periodic catch-ups were always a blend of nostalgia and industry insights. Samir looked thoughtful, the lines on his face telling stories of countless doctor calls and achieved targets. Priya, it's great to see you. Congratulations on the new role.
Key account manager, it sounds so corporate.
I remember when our biggest worry was getting 5 minutes with a busy doctor. We just had our detailing bag, our samples, and our persistence. We built relationships one doctor at a time, one clinic at a time. It was a simple game, really. You knew your doctors, you knew their prescribing habits, and you made sure your brand was always on their mind. It feels like that world is fading fast. Priya smiled, understanding his sentiment completely. She respected the hard work of veterans like Samir, the foundation upon which the industry was built. Thanks, Samir. It's definitely different. But in a way, it's also the same. We still build relationships. The difference is that now we're not just building them with one doctor. We are looking at the entire hospital as one big doctor, one key account. Think of a large corporate hospital chain like Apollo Fortis. So many decision makers are involved beyond just the prescribing physician. There's the pharmacy head, the procurement department, hospital administrators, even the finance team. I see what you mean. We are seeing that more and more. A doctor might want to prescribe our new oncology drug, but if it's not on the hospital's approved drug list or formulary, his hands are tied. We used to just focus on the doctor's pen. Now it seems we have to influence the entire system that guides that pen. It's a much bigger, more complex puzzle to solve. My manager keeps talking about this KAM approach, but for many of us on the ground, it feels like a very abstract concept. But why is this happening now, Priya? The old way worked for decades. We built brands, we met targets, companies grew. What's changed so drastically in the Indian market? Now that felt like just the entry ticket, not the grand prize. The rules were being rewritten, and he wanted to understand why. Priya leaned forward, her expression animated. She was passionate about this shift and eager to explain it.
Let's break it down, Samir. Think of it this way. A traditional medical representative, or MR, is like a sprinter. The goal is to win the short race. Get the prescription from the doctor today. Key account management, or KAM, is like training for a marathon. The goal is a long-term sustainable partnership. It's not just about selling a product, it's about becoming a valuable partner to the entire hospital, or what we call the key account. The focus shifts from a single transaction to building a mutually beneficial long-term relationship. So, instead of just detailing the features and benefits of my drug to a cardiologist, a KAM would try to understand the hospital's bigger goals. Does the cardiology department want to reduce patient readmission rates for heart failure? If so, my role is to show them how our drug, combined with our patient support programs, can help them achieve that specific goal. It's about aligning my company's value with the hospital's objectives. We move from being a simple supplier to a strategic partner who helps them solve their problems and improve their overall performance.
A strategic partner. That's a big leap from being the guy who drops off samples and reminds the doctor about the brand name. So a key account isn't just our highest prescribing doctor anymore. It's an entire institution, like a big multi-specialty hospital, a major diagnostic chain, a government health program. This was a significant shift in perspective for him, moving from a personal one-on-one interaction to a complex, multi-layered institutional engagement. The individual doctor was still important, but he was one piece of a much larger ecosystem.
Exactly! A key account is any organization that has a major impact on our business now or in the future. It could be a large hospital group like Manipal Hospitals, a government body like the Central Government Health Scheme, or even a large insurance provider. These accounts have complex decision-making processes. The KAM's job is to understand that whole process, identify everyone who has influence, and build a relationship with each of them. It's about creating value for the entire account, not just securing a single prescription. That's a perfect analogy, Samir. And this partnership works best when it follows a structured process. At my company, we follow a 6-step KAM model. It provides a clear roadmap for managing a large account. It helps us move from being just a vendor to becoming that strategic partner we talked about. The first step sounds simple, but honestly, it's the most critical. Account analysis. This is where we do our homework. We gather every piece of information we can find about the hospital. Who are the key decision makers? What are their strategic priorities? What are their biggest challenges? The second step is opportunity identification. Based on our analysis, we look for areas where our company's strengths can help the hospital achieve its goals. For instance, a hospital in Delhi launching a new diabetic center of excellence. That's a huge opportunity. Diabetes drugs, glucose monitors, patient education programs. We are not just pushing a product, we are looking for a problem we can help solve. Step 3. Building the account plan. This is our strategic blueprint. It outlines our specific objectives for the account for the next year. What do we want to achieve? Who do we need to meet? What resources will we need? What value proposition will we present? The plan is shared with everyone involved, including the MRs like you. It ensures our efforts are coordinated and focused on the same goals. Without a plan, we are just reacting. Then comes step 4, gaining commitment. This is the action phase, where we present our value proposition to the key stakeholders at the hospital. This might involve a formal presentation to the hospital's pharmacy and therapeutics committee. We show them how a partnership with our company can help them improve patient outcomes or reduce costs. Step 5 is implementation. Once we get their agreement, we have to deliver on our promises. If we promised a doctor training program, we execute it flawlessly. And finally, step 6 is value tracking and review. We constantly monitor our progress, track the results, and review the partnership with the hospital to ensure we are delivering real value.
Samir was intrigued. Could you give me a real-world example of how these 6 steps work? Let's say for a new advanced antibiotic in a hospital like Medanta in Gurugram. He wanted to see how this theory translated into practice on the ground, in a hospital environment he was familiar with. Abstract concepts were useful, but concrete examples made them real and memorable. He imagined himself trying to apply this process in his own territory and wanted to visualize the journey from start to finish.
Great example. For step 1, account analysis, I would first map out Medanta's entire structure. I'd identify the head of the infectious diseases department, the chief of the ICU, the pharmacy director, the head of procurement. I would use online sources and my network to understand their priorities. Maybe they are focused on fighting antibiotic resistance. That's a key piece of information. I would also analyze their current antibiotic usage patterns to see where the gaps are. This is the deep dive research phase. For step 2, opportunity identification. Knowing their focus on antibiotic resistance, I see a clear opportunity for our new next-generation antibiotic. It has a unique mechanism of action that is effective against resistant bacteria. The opportunity isn't just to sell the drug, but to partner with them on their antibiotic stewardship program. For step 3, building the account plan, I would create a plan to engage the key stakeholders. The plan would include presenting clinical data to the infectious disease team and an economic model on reducing patient stays to the hospital administration. In step 4, gaining commitment, I would arrange meetings. I'd bring our medical science liaison to talk to the doctors about the clinical evidence. I'd present a value analysis to the procurement head, showing how our slightly more expensive drug could save them money in the long run by preventing complications. For step 5, implementation, once they agree to add our drug to their formulary, we would deliver. We might help them develop new treatment protocols and provide educational materials for their junior doctors. And for step 6, value tracking, 6 months later, we would review data with them. We'd show them, since you started using our antibiotic, your rates of a specific hospital-acquired infection have dropped by 15%. That proves our value and solidifies the partnership.
That's a very thorough process, but it also sounds like a lot of information to manage. How do you keep track of all these stakeholders, plans, data? In my day, it was all in my diary and in my head. I can't imagine managing that level of complexity for multiple hospitals with just a notebook. Priya pulled out her tablet.
This is where technology becomes our best friend, Samir. We don't use diaries anymore. We use a CRM system, which stands for Customer Relationship Management. Think of it as a super intelligent digital diary. For my Medanta account, every single interaction is logged. Every meeting I have, every email I send, every promise I make. The system reminds me of follow-ups. It gives my manager a clear view of my activities. Most importantly, you, as the MR on the ground, can also access the CRM to see the account plan and add your own notes from your doctor calls. Then there's e-detailing. Instead of carrying heavy visual aids, I use this tablet to present. The presentations are interactive. I can show a video of a key opinion leader discussing our drug, an animated video showing how the drug works in the body. If a doctor asks a specific question, I can instantly pull up the clinical study that answers it. After the meeting, I can email a link to the presentation directly to the doctor. It's more engaging, more professional, and allows for a much deeper conversation than a paper visual aid. And perhaps the most powerful tool is data analytics. Our company provides us with dashboards that analyze prescription data from chemists, prescription data from stockists in real time. I can see which doctors are prescribing our product, which are not. I can see the impact of our activities almost immediately. For example, after running a campaign in a specific hospital, I can look at the data a month later to see if prescriptions have gone up in that area. This data helps us understand what's working and what isn't, so we can adjust our strategy quickly. We are no longer flying blind. We are making decisions based on hard evidence.
So, does this mean my role as an MR is becoming obsolete? If KMs are handling these big hospital accounts and talking to administrators, what's left for people like me who have spent their careers building relationships with individual doctors in their clinics?
Not at all, Samir. It's not about replacement, it's about teamwork. Think of the KAM and the MR as a specialized team, like a surgeon and an anesthetist in an operating room. They have different roles, but they work together for a common goal. The KAM works top-down. They engage with the hospital's leadership, the CEO, the medical superintendent, the pharmacy chief, to get our products approved on the hospital formulary and to create a favorable environment for our brands. They are opening the main gate for the entire company, and the MR works bottom-up. Once the gate is open and the drug is available in the hospital pharmacy, your role is more important than ever. You are the one who works with the individual doctors in the OPD and the wards. You remind them that our drug is now available. You explain the clinical details, answer their specific patient-related questions, ensure they are comfortable prescribing it. You are the one who drives the actual prescription pull-through. The KAM creates the opportunity. The MR converts that opportunity into reality, prescription by prescription.
So, the KAM gets the car into the showroom, and the MR is the one who convinces the customer to take it for a test drive and actually buy it. We are partners. The KAM's success depends on me driving prescriptions, and my success depends on the KAM getting the drug approved and available in the hospital in the first place. We need each other. I've been hearing a lot about these bigger events. My manager is pushing for more group detailing and CMEs. In the past, my focus was always the one-on-one meeting in the doctor's chamber. These group activities feel less personal. How effective are they really?
They are incredibly effective, but for a different purpose. Think about a busy government hospital like KAMs in Delhi. A department might have 20 resident doctors. Meeting each one individually is nearly impossible. With group detailing, we can get permission from the head of the department to do a short 15-minute presentation for all the residents at once during their morning meeting. This way, we can deliver a consistent core message to the entire team in one go. It's about efficiency and reach. You can't have a deep personal conversation, but you can create widespread awareness very quickly. And CMEs are on another level. Doctors need to constantly update their knowledge to maintain their licenses. We can support this by sponsoring high-quality educational events. For instance, we could invite a renowned national expert to speak to the top cardiologists in a city about the latest advancements in hypertension management. Our brand is associated with this high-level science. It positions our company as a leader in the field and a partner in medical education, not just a seller of pills. The key is that it's not a direct sales pitch. During a CME, our focus is on providing genuine scientific value. The educational content must be unbiased and credible. our product might be mentioned as one of the treatment options within the broader scientific discussion. This approach builds immense goodwill and credibility. When doctors see that we are invested in their professional growth, they are more likely to trust our company and our products. It's a powerful way to influence a large group of key opinion leaders and senior doctors at the same time.
This all sounds very strategic and impressive, Priya. But with all these new ways of engaging, partnering with hospitals, sponsoring CMEs, the lines can get blurry. How do we ensure we are always doing the right thing? In the old days, the rules were simpler. Now, with these complex partnerships, the potential for ethical missteps seems higher. He had seen how aggressive marketing tactics in the past had damaged the industry's reputation, and he was cautious about any new approach that could be misinterpreted.
You've hit on the most important point of all, Samir. Ethics and compliance are not just a part of the job, they are the foundation of everything we do. Our industry has a huge responsibility. Our products save lives. Because of this, we are held to a very high standard. Every single activity, from a simple one-on-one call to a large-scale hospital partnership or a CME, must be guided by a strict ethical code. There is zero tolerance for cutting corners. The trust of doctors and patients is our most valuable asset, and it's very easy to lose. For example, when we partner with a hospital, the basis of the partnership must be on the value our products and services bring to patients. It can never be a quid pro quo. We can't offer an improper inducement in exchange for the hospital prescribing our drug. The Uniform Code for Pharmaceutical Marketing Practices, or UCPMP in India, is very clear on this. All our interactions are transparent and documented. We are not buying business. We are earning it by demonstrating superior value for patients and the healthcare system. The same applies to CMEs. The primary purpose must be genuine education. We cannot organize lavish events at exotic locations just to get doctors' attention. Venue must be appropriate. Content must be scientific and unbiased. Any hospitality must be modest. Our company has a dedicated compliance team that reviews and approves every single KAM plan and every CME proposal to ensure it adheres to both the law and our own internal code of conduct. In the modern pharma world, success without integrity is failure.
As they finished their coffee, Samir felt a renewed sense of purpose. The future of pharma sales no longer seemed intimidating, but like an exciting new challenge. Priya, this has been incredibly insightful. It's clear the skills that made me successful 10 years ago are not enough. For someone like me, and for the young people joining our industry, what are the most important skills to develop to succeed as future pharma managers and leaders?
I think it boils down to a few key things. First, strategic thinking. Move beyond the next sales call. Start thinking like business owners. Analyze the market. Understand the competition. Build long-term plans for key accounts. See the bigger picture. Connect the dots between a hospital's strategy and ours. Second, financial acumen. Be comfortable with budgets. Understand cost effectiveness. Talk about return on investment. Hospital administrators think this way, speak their language. Build a business case that shows economic value for the hospital, not just clinical value for the patient. This needs higher analytical skill, beyond memorizing brochure data. Finally, collaboration and leadership. The era of the lone wolf is over. Success in KAM is a team sport. Lead a diverse team of Mrs.-led medical experts. Lead marketing colleagues. Be great communicators. Align everyone around a single account plan. Foster trust, foster transparency, uphold unwavering ethical conduct. The future pharma professional is more than a salesperson, a relationship builder, a business strategist, a trusted partner to the healthcare ecosystem.